All right, so shoulders back and just a little cat-cow. To make it easier on the wrist, if you have the hands a little forward of the shoulders, I like to keep the weight through to the front, the ball of the hand, so to speak, so I'm not heavy on the wrist. Try to lengthen out the palms and the fingers, and then just a gentle curving, which you could sequence if you wanted. You could do lower, middle, upper, and reverse, or go the same way. So you can just play around with isolating from top to bottom, from bottom to top, or everything all together. Connect with your breath, and the breath could be either way. You could inhale as you curve, and that would create a little more filling into the back body, and exhale as you arch the spine or go into extension. I quite like doing it the opposite way around, but again, whatever feels enjoyable. Connecting with the breath, mouth, lips, and jaw relaxed. And then we'll do a little bit of our sit back one. Again, lengthening through the palms. The shoulders remain broad, but as you take your hips back, the shoulder blades could elevate a little bit. They don't want to go scrunch towards your neck, but they could elevate up a little bit. And as you come up to all fours again, the shoulder blades could draw down the back. So as your arms, in a sense, get overhead, the shoulder blades are designed to slightly slide up. As your arms come a little bit more underneath you, drawing the shoulder blades back, connecting with breath again. The obvious breath order with sit backs would be to breathe out as you go back, because your abdomen and chest are getting squished against the legs, and inhale to open. But again, whatever you want to play with. And you could also do a few where you take the knees a little bit more apart from each other. So it's a little wider, a little more space for the body in between, quite nice on the hip sockets. Coming back to all fours, we'll just do a couple more things here. Let's do the one we have a neutral spine. You draw the belly in from the pubic bone towards the navel, or connecting from hip bone to hip bone. So the belly slightly drawn into the body, a neutral little bit of a curve here. And this one, you can either do what I call treading cat, where you just lift one hand off the ground a little bit and then the other, and keep your body centered. Or if you feel all right with the wrists and the shoulders, you can extend one arm forward. So you're still looking at the floor, but we call this one pointed dog. Your arm is pointing wherever you want to be going. And you're trying to minimize shifting your weight from left to right. So we're just beginning to fire up the core a little bit. Long through the back of the neck. Think about pushing the ground away, so your ribs are connected to your shoulder blade. I'll come and have a look at you guys. Minimizing the rock from side to side, trying to hug the midline. Modifying anything that we do if you have a particular difficulty today. And we'll just do a little bit of our marching exercise. So finding the distance of your feet from your hips that allows there to be the natural curve in the small of the back, the ribs soften down, enough head height for that to happen. And here, this is the one where we lift one leg off the ground. I like to do the exhale and then inhale, come back down. And again, start the exhale, drawing the belly in, and then floating the other leg off. And just doing a few of these in your own time. Once you've got the idea, just look to the ceiling. As you inhale, feel yourself breathing into the back ribs. And although this is not a lot of weight, there is a lot of control in making sure that your hips and your ribs do not shift away from the floor as the opposite leg lifts. That you're keeping the 4 points, the base of the left and the right shoulder blade, the left and the right back of the pelvis remain absolutely motionless. And you can make this more of a core activity by even more drawing the belly a little deeper into the body, and that will give you the sense of those stabilizers and the psoas working to float the leg up, so it will be very floaty in the hip socket and very strong in the abdominal region. Now, if anything that we're doing as we proceed doesn't feel right, you can always rest in this feet on the ground or do a little bit of more marching. That would be totally fine. But if it's feeling okay today, your back is good, then you're going to bring one leg up to tabletop. And again, brace, drawing the belly in and bring the other leg up. So you try not feeling that your body gets shifted. That looked good there, Sue. That's good. And then one leg drops down towards the floor and then scoop with the belly to bring it back up. So there's still a little bit of a gap in the small of the back. The ribs are down, the pelvis is neutral, the leg drops down and then it comes back up. Think about, again, pulling in, psoas pulls back like a crane to bring that leg back up. Funny enough, they're dismantling a crane across the road today. And you don't have to get to the ground. You could just go a little bit down and then up. But once you've got the idea, again, potentially don't look at the screen and look at the ceiling and organize yourself. If you're feeling you want to have another check, bring your feet down, have a rest, have a look, and then go again. Back of the ribs, back of the pelvis. I use my exhale to bring the leg back up, pulling the belly in. But you can breathe in either way, so long as you're breathing. If you need a break, remember to come out of it with control, which is bringing one leg down carefully and then the other. All right, and then we'll all have a little break. Carefully bring one down, the other one down. And if you want, you could just gently sway the knees a little bit from side to side, just massage across the back of the pelvis. And we're not going to do the whole sequence today, but let's do a little bit of our crisscross one. This is the one, we'll do the one where we have the feet on the ground. You drop the rib cage, you support the back of the skull with your hands, you keep your elbows wide, you keep that little gap in the small of the back. If you're lifting the right leg, you're rotating your left armpit in the direction of the right leg. You're not trying to get elbow to knee. You're just trying to get the obliques, the kind of crisscross muscles like an X on the front of the body. So you're shortening one of the X lines as you come up. They come back to center, and then the armpit to the hip region gets a little shorter, and then you come to center. So in your own time, I tend to exhale as I cross, inhale to the center. You can be supporting your head, have a gap between your neck and your throat. The alignment between your head and your upper body is not changed. It's just a slight tip of the rib cage to engage those upper abdominals. I'm going to see what I can see of you with your videos. Nice. So this is all good. And if you can, keep the elbows wide. There we go. We'll do a little bit of our clams and some leg circles. So we'll lie on our side, I think. So this one is shifting onto our side. You can either have a blanket between your arm and your head, or you can fold your blanket or have a cushion that's deep enough that you can lie on your side like so. Have your head and spine in a straight line, so not all fetally curled up, unraveled. And if you can, lift the underneath waist, so there's a little gap in there. The top arm can either rest there or on your hip, whichever you like. Then the knees drop down a little bit, your feet are back in line with your buttocks. And for most of us, I feel like this is a little pressure on the outside of my hip. It's easier if I lift the feet, but you don't have to. So still a little underneath lift. And this is the one where you want to feel like your buttock area is engaging to lift the knee up and then release down. Now, if you want to start with a few little pulses, sometimes Carol suggested that that's quite a good thing for her. You can just keep that leg up, and in the last inch, just pulse it a few times to really kind of awaken the muscles and feel like that is what is helping you. They're rotator muscles. It's called a rotation of the hip, external rotation. The other interesting thing is that though when you come to do the full range, it's internal rotation down and then external rotation up. So we're getting quite a nice range on the hip. So just going through with that. Make sure the neck is at ease. And I like to feel like, yes, my buttock muscles are slightly engaging to help lift that, rather than, you don't want to get sensation so much in the outside of your thigh. You want to feel like it's really, the work is predominantly in your buttock to lift that knee up. And see what range you can get. How high can you go without leaning back? So keeping that top hip stacked above the underneath hip and not leaning back to get the leg up. And maybe we'll just do a few pulses at the top here. So you just pulse up 8, 7, 6, 5, 4, 3, 2, 1. Relax that knee back down. And then let's do straighten out the lower legs a little bit. And they're going to be just slightly forward of the body to help balance the fact that the top leg, we're going to lift up to parallel and take it into a little walking motion. So you're going to swing the leg back. Now you can lean forward a little bit to help, but keep the ribs into the body. So the leg is straight as it swings back. So you feel your upper buttock. At the very end, you could bend the knee and carry the leg forward and then straighten it forward. Now, as it comes forward, don't let the knee drop to the floor. So it swings back straight all the way till you feel your upper buttock area work. At the very end, you can bend it, but see if you can carry it forward in parallel without the knee dropping. That's it. And then straighten it out. So you're working against gravity. That's it. But really make sure it's the back engagement that we really want. So we tend to easily go forward. We don't so easily lengthen through the front, engage through the back. That's why we started off with that psoas release, so that we can get that lengthening through here. If we were walking, that would be the extension. You would feel that back buttock working, back of the leg taking you back. And this time, leave that leg back behind you. And then we just go up and down a few times, again, getting that upper buttock area going. And then give it a good old rub. And you can either roll over, or I'm going to kick the top leg, push it away, bring myself up, keep that head back in line with your spine. And then we've got on our other side, find that right position for the head, bring the head back, lift the underneath waist, feet back in line with the buttocks. Partly this alignment just to make sure that we maintain that little bit of a curve in the small of the back, the natural curves of the spine. And for most of us, lifting the feet up off the ground is easier. So you're just pressing on the underneath thigh. That gives you this little bit of internal rotation, and then you open out to external rotation in the hip socket. We need a little bit of everything. Like we need rainbow colored veggies. We need rainbow variations of movement in the body. And if you want to do it last time on the other side, we did a few pulses just to awaken at the top at the beginning. But if anything gives you, hip pain, either deep in the groin or too much on the trochanter, then modify or stop and ask me a question. We'll see if we can find another way. And otherwise, we'll continue through to those repetitions all the way down, all the way up without leaning back. Keeping the lower ribs a little into the body, the underneath waist ribs a little elevated from the floor. So as if our body is neutral rather than mermaidish on the ground. Oh yes, my hip is saying yes, that wants this one. What is your hip saying to you? All right, then we're going to go up and do our pulses. 10, 8, 7, 6, 5, 4, 3, 2, 1. Good-o. Take the legs a little forward of the body, so you straighten out the legs. The top leg's going to lift to parallel, and you might need to lean forward again a little bit with the upper body to help get that leg well behind the body so you feel the buttock working, the stretch on the front of the leg. At the very end, you can bend the knee, just like you were walking. Carry it forward. Watch the knee doesn't drop as you carry it forward. Straighten it out and extend it back behind you to feel that buttock working. Should be no pain in the back, just a sense of hamstring releases here a little bit. Front of the thigh lengthens as it goes back. Buttocks, upper buttock engages, and then you can softly bend the knee, and we'll do a few kind of like a slow motion walk. And of course it's good because we're actually holding our leg against gravity, so it's good hip strengthening work. And then we're going to keep that leg behind this next time. So behind the line of the body till you feel your upper buttock area working, not too arched in your back. Keep the ribs in at the front, and then up and down we're going to go here. You can do it slow or quick. I'm going to go slow today. But it's glute medius more, so it's one that connects from the outside of your hip and wraps onto the top back of the buttock area. And just make sure that leg's behind you enough. So you don't want to feel it too much on the sideline. It should be on the back line. All right. And then when we're done, we can have a little rest, bend the knees, give the buttock a rub. And just so that we get both buttocks working at the same time, let's roll onto our backs and do a few bridges. Well, the bridges, probably nothing underneath the back of the head for most of us, unless it's very uncomfortable, in which case you could have a slither. And here, arms long, spine in neutral. Now, to make sure we keep the upper buttock working, that's why we're not flattening the low back before we go up. So we don't want to flatten the back waist. We want to keep it in its neutral position and just lift everything together. Once you've got the idea, you lift everything together, ribs are softened down, and then you just gently come down. You can pause at the top. Once you've got the idea, don't look at the screen. See if you can just look at the ceiling. I've got the blue of the skylights today. Connect with your breath. Feel the buttocks at the top. You could do a couple of pulses at the top if you wanted to, or you could just sort of hang out there for a little bit and feel the length through the front of the thighs, engagement at the back and the buttocks. If it's cramping your hamstrings, you could lift the front of the foot off and you could just be on your heels, which would just encourage your hamstrings not to over shorten. And then you're going to go up and pause at the top, and then just let one hip softly drop a little bit, and then bring it up. And then let the other hip softly drop a little bit and bring it up. And try that one more time each side. And then lengthen back down. Nice. And then before we come up, let's take the blanket back underneath the back of the head. Just a little bit, arms out to the side. This is where you would bring your right hand to your chest. Your left knee would relax out to the left. Your right hand slides across the chest. Your right leg follows. You end up rolling onto your left side with your head just hanging. Then your right hand strokes down your left arm. Your right knee fans open, so the hips are in a little bit of a butterfly position. The right arm unfolds. Your left hand finds your chest. Your right knee is searching for the floor, and your left foot helps roll you onto your right side. So just a very slow motion roll from side to side with a little butterflying open of the hips, and in between a little dance with the floor, a gentle stroking down of the arms and the fingertips, head just heavy. And then when you're ready, we'll roll all the way onto one side on our way to transition to coming up. If you need a little softness for the knees, you could have your blanket like so. Maybe we'll just do a little bit of our hip flexor stretch where you have, where you're on one knee, 1 foot forward. And in this one, you slightly tip the pelvis under. Keep the ribs into the body. Sometimes people feel like they need to lean forward a little bit. I find it's enough here. And then if you've got your balance, you could take the same arm as the leg that's getting stretched up. Keep the ribs into the body because there's that attachment from the psoas onto the front there that we're lengthening. All right, and then we could change to the other side maybe. Other leg down, other leg up. This is the only time I tell you to tuck, so you think about your tail coming a little bit between your legs, your pubic bone to your navel slightly coming up, your ribs staying in. If you need to, you have support on the leg or a chair, and then the other arm up. All right. And the ways to come up is, if you can, there's this version where you tuck the toes under, and sometimes people need to press into the knee, but otherwise you're pressing into the feet to come up. So just have a little walk around, see how you feel. If you have any, and maybe just have a little shake in between, because I feel like it would be good for us to now do our little bit of our squats. And again, if squats feel like they're challenging, just do them small. Go a little way, don't go all the way. But I think, and again, it depends on your hip sockets, how wide your legs are, how turned out or not your legs are. See if you can find, we all have to adapt a little bit, modify to the way our hip sockets are designed. We're all a little individual. So this is 2 ways. Let's do a few of the save your back version, which is, and save your knees, which is that you take your hips back, your arms can just float forward, don't let the shoulders pull forward, and then you stand up. So it's the hip hinge with your bum going back, your head in line with your spine, and you come up. And I've been playing around with alternating the breath from what I used to. I've been playing around with inhaling down and exhaling up to help me engage core, help me engage buttocks. Inhaling down, exhale, press through the heels, engage through the buttocks. Let's do 3 more. Then the other way that I do squats is I keep the body a little more upright. I let the knees go a little forward, because in life, if you go downstairs, your knees have to go a little forward. They need different ranges, but again, be careful with your knees. So when I do these ones, I more just sit a little more upright. My knees are coming a little more forward, and I'm not slow. I'm keeping my body still head in line with spine, but I'm just thinking about dropping my buttocks, more like coming to mind, just like how people squat, how people do things, particularly in the East. But this is how I did the washing, put the washing in this morning, put that in, clean the shower. But it does create hips, you need hip strength to do this a lot. But I think practicing it is part of getting them stronger. And if you want to challenge it, go down and stay for a breath or 2 and then come up. and use your exhalation, ground into your heels, engage your buttocks, and use your thighs to get back up. So staying down for a little bit is quite a challenge. If you want to do one more. Sometimes I shift a little bit from left to right and then ground through the heels, engage through the buttocks. And amazingly, my knees didn't make any noise today at all. But a little bit of creaking and cracking is not harmful, so long as there's not pain associated with it. That's the science on it. But I do normally find is after I've done a few things, everything starts to get a bit smoother, feels a little bit more mobile. All right, have a little walk around the room, see how your hips are feeling now. Standing tall. For those of you that hang forward, think about taking the thighs a little back. That's it, Juliet. Yes, exactly. Good, good. Nice, nice. And then this is the one where we take, you bring your right arm up and you take the right arm diagonally across to the left. Draw the right elbow back behind you and then twist back to your left, right. I got confused, but it's diagonally across, to your left and diagonally back to your right. Let's do that 4 or 5 times one side. Connect with breath. And when you're ready, the other side. Taking in the space around us. Easy with the breath, smile if you wish. All right. Yeah, some circles maybe.